Welcome to Kerala Ayurveda Kalpam Talks. Today we are going to discuss about postpartum care, the known, the unknown, and the mistaken.
Today, we are honored to host an inspiring session with a distinguished expert in the field of Ayurveda, Dr. Anita Kishan. Dr. Anita holds a BAMS and MD in Prasuti Tantra and Sriroga from Government Ayurveda College, Trivandrum, and for the past 20 years, she is an integral part of the prestigious institution VPSV Ayurveda College, Kottakkal, currently heading the department of Prasuti Tantra and Sriroga. So welcome ma'am to Kalpam Talks by Kerala Ayurveda. So before we begin some serious discussions, we would love to know a little bit more about you on what was your journey in Ayurveda like and what inspired you to specialize in Prasuti Tantra and Sriroga.
Feeling comfortable with you both.
Thank you.
Good afternoon.
Yeah.
I joined Government Ayurveda College, Thiruvananthapuram in 1989-90 batch. As most of the aspirants of medical academy, Ayurveda was not my first option,
Yeah.
So after coming to Ayurveda College, it was a festive season then.
Okay.
The college was hosting the first Ayurfest, and in that mood, in that elated mood, the institution was. I joined in BAMS with my two schoolmates were in the same class.
Okay.
And one among them was a singer. She actually was planning to participate in the Ayurfest. She had a very bad, long history of sinusitis.
Okay.
So she faced problem to participate, but she wished a lot. After joining, second or third day, her roommate suggested Nasyam for her. Nasyam with Anudailam.
Okay.
The roommate herself instilled the Anudailam. And after 2 installations of the medicine, she was almost relieved of the symptoms and she was very satisfied.
Oh,
So, witnessing that, I was really attracted to the system. It was
First-hand experience.
Yes, first-hand experience. While going through the syllabus and all, I felt that this system is something different that we have not experienced earlier. In the current scenario, this term is more apt, I think. The personalized medicine, Prakriti-based, and then the digestive system is considered, bowel movements are considered, everything is considered, and then nobody can prescribe a common protocol for, even for a single ailment, we can't prescribe a common protocol. So there is some sort of craftsmanship, I feel, or the art of healing. So I was highly impressed. Moreover, I had a passion towards literature. So we had syllabus in Sanskrit syllabus where we have to learn some literature also, Raghuvamsham, Kumara Sambhavam, everything. It was also interesting for me. So that's the journey started. We were posted in maternity hospital, Pujapura. It is a unique hospital in our state, as you know, where this Ayurveda and Allopathy join hands together and work together and providing the health needs of the women, ANC, PNC, gynec, everything. While getting exposure in that area, I think the first spark came into my mind. Better to specialize in this subject. After BAMS, I joined Prasuti Tantra. It was my first option. I joined and I got a lot of opportunities with the eminent teachers of that time. Dr. B. Shamala, late Dr. B. Shamala was there. She was under deputation in the institution and I had the opportunity to get almost well-versed in the speciality. Then Dr. Nalnakshan was there and my guide, Dr. Valsan. So all these persons inspired me for a better being in this area.
I can also see how your journey as a poet also was nurtured by Ayurveda, because having that literary aspect also covered in the first year kind of must have fueled that. Today, we look at you as an epitome of the subject. I can see that you are a proficient academician and also a highly accomplished clinician. So how do you find balance between the two? How do you get inspiration from these different hats that you're wearing?
I don't know whether that much successful, that much I am. But my area of engagement, both as a physician or a clinician and academician in the same area, that is Kottakkal Ayurveda College. What we are narrating in the classroom is elaborated in the clinics. There is not much difference. So we can show the practical aspects. Students will be getting confident. The gynecological ailments are having good responses with Ayurvedic treatment. Safe and effective therapies are there as far as medicines or therapies are concerned. So such responses give us more inspiration to continue for innovative things, clinical steps. In areas like pelvic inflammatory disease, chronic pelvic inflammatory disease, as you know, it is a recurring complaint. So once we are effectively managing it, it won't recur. So this we can show to our students. So they are getting satisfied. So reduction in size of some surgical conditions like fibroids. From my PG days onwards, I have observed, my study was on Utravasi with Kyla in dysmenorrhea, painful menstruation. So during that period, I have seen in many patients dysmenorrhea with the adenomyosis, that is the myometrial endometrial fragments. In those conditions, after the installation of Utravasi, the condition was completely cured. Relief from pain, the condition itself was cured. So it was evident from the sonological reports. Such things or such responses were very welcoming, and we were able to explain this to our students and show them the responses. And so in that way, the evolution happened.
In addition to getting a good level of management, the recurrence rates were also
coming down. And also in other conditions, also HPV, then CIN 1 and 2 precancerous conditions, also Ayurveda is doing the best. So all this we can practice and show to our students. So that will be good for them. And in our growth also it is facilitated, I think.
Yeah, exactly. So, ma'am, coming to the current scenario in Kerala, we are very much aware of the postpartum care and practices. Being a Keralite, we know that it's part of our culture actually. Yeah. But the question is, how much is authentic Ayurveda involved in these practices? Because we can see that, a lot of clinics are opening recently saying that, they are giving postpartum care only. Yeah. And so how much is authentic Ayurveda practiced, and what is the kind of, national and international awareness when compared to Kerala? What is your thoughts on that?
Authentic Ayurveda with respect to PNC is a rarity, I think. The clinics are flourishing a lot. But authentic centers are very less. We see,
Yeah.
It is the fact. Regarding PNC, all are authorities. People feel so. I know this, we know this. Those who are managing, that is this home nurses or days, or everybody, they think that they know even medicines, combinations, everything, what to prepare, what to give, what are food to give. It has no scientific background. In many a situation, errors are happening, and allopathic people are blaming us. Setting up a postnatal clinic is very easy as far as these people are concerned. And they recruit some person who has some sort of this therapeutic experience, and they are liberally doing with unwanted medications, I wish to say, which are not apt for the conditions.
Understood.
This is the actual situation. In between, authoritative centers are there, medical colleges-based therapies are there, centers, renowned Ayurvedic centers are doing in the normal way, authoritative way. I observed that other states, national and international, you asked, other states are not much involved in postnatal care, I feel so. In Tamil Nadu, certain areas are well versed and they are practicing. I've seen in Tirunelveli, then Kanyakumari. In such places, there are a lot of practices, postnatal practices. Very similar to our medicaments, such as polylehium, this thing, ulva, etc. They are using. Certain specific medicaments are also there. I think in the initial stage of postpartum care, they give asafoetida, ferla foetida with ghee as an appetizer. In Tirunelveli, it is regularly practicing. Some influences of Puducherry is seen in Mahi. In Mahi, they are having very good postnatal care practice. They use many medicaments in podi, churna based, and lehas prepared out of it. Churna means some cereals are there, then this chadurbija, everything added, and they start administering it on 15th or 18th postpartum day for 1 month or more. Such activities are there. Then the medicated water they are using is commonly made out of this mango leaves. Mango leaves.
This is in
Then,
Mahi.
Yes, Mahi. It is actually the Puducherry influence.
Okay.
And that influence is transmitted to Calicut as well as Kannur, the nearby districts.
Yes, I can relate to that.
Yes, there is difference in practice here and the north. This may be one thing. That influence of Puducherry is there.
In fact, most regions would have their own native,
Their own native traditional practices are
but
there.
In many places, what happened was it slowly kind of went into oblivion. People were not seeking it or using it, and eventually they might have forgotten.
Yes.
I have a concern which kind of dials back to this question, like even further. Because I believe that, birthing is not a disease, right? It's kind of a natural process. It is a natural process.
Yeah.
So we also see that many mammals, higher mammals also giving birth and just recovering just like that without an intervention.
Yeah.
So why do humans need postpartum care in the first place? And if yes, then what is the role that Ayurveda has to play exclusively?
Yes, sure. There is a role, and there are differences existing between mammals and humans. Regarding Mahi, I have told. Then other states, Odisha, Bhubaneswar, they use only one thing. They apply coconut oil to mother and baby. No other application. In the urban areas, rural, I don't know. In the international level, the Chinese traditional medicine is almost equal to Ayurvedic practices. But therapies are not much employed. A lot of medicaments, then soups, herbal teas. For the evacuation of uterine contents and rejuvenation, they are using. They have this hot and cold theory, yin and yang. Yin, yang.
Okay.
So they strictly prohibit exposure to cold. Exposure to cold is very harmful to the postpartum woman.
Oh.
So they strictly prohibit exposures.
Understood.
That is one important thing. Chinese medicine, they are practicing in US also. US based clinics are there.
Very popular in the US.
There, this thing, postnatal care
here.
is providing.
Okay.
Then Malaysia, Thailand, this postnatal care is prevalent. And Thailand, massages are there, special massages, postnatal massages. And lying near the fire is one thing. This warming up process is very important to all these Oriental countries.
I see.
Warming up. We also follow the same to prevent Vadagopa. So that is the international aspects of postnatal care as much as my knowledge.
Okay, so it's interesting to see that the yin and yang or the proximity to heat is very much matching to what
what
Ayurveda
you
is
follow.
advocating, Ushnobachari and all these things. So my question, why do you feel that postpartum care is required?
Postpartum care is essential because there is some difference existing between mammals and humans. First thing is our posture.
Posture itself, yes.
Your erect posture, that is, we have to withstand the effect of gravity. Mammals, you see their womb is horizontal almost. When we are in the erect posture, it is almost at right angles, but not. The birth canal is directed towards gravity. So its influences are there. Then our bodies are not well toned. We are not well exercised. Animals, they have to procure their food. So they are doing a lot of efforts, exercises daily. It's part of our daily routine. Then this rapid succession of pregnancies, irrespective of rest, it will create problems like genital prolapse. It is very common if one is having successive deliveries without spacing. It will happen.
Prolapse.
In our clinics, we see
multipara
women are having prolapse, either uterine prolapse or bladder or rectal prolapse. So this may happen. You see one thing, the expected date of delivery, EDD. Another word is there, another abbreviation is there, EDC. What it indicates? Expected date of confinement.
Okay.
Confinement is there.
All right.
Okay.
So the rest, proper rest. That means no activity is not the meaning. They can move about. Early ambulation can be allowed, but so much of strenuous activities should not be done. And proper care, if you are giving, it will tone up the musculature, the supporting system of reproductive structures, and it will be beneficial for her further reproductive health as well as general health.
General health. Even though you cannot jump into your normal life from day one, there has to be this EDC in which they
Yes,
can slowly
confinement
get
is
back.
there. Chinese medicine and other countries also, they are confined.
confined.
Strictly confined, more than us, I think.
Okay.
So yeah, I think we have already started addressing some myths.
Some of the myths, yes.
Because people usually say that Ayurveda says that you should not move at all after your delivery, which is not actually there,
No,
right?
it is not acceptable. You have to move about. The early ambulation is beneficial for the evacuation of uterine contents. The uterine contents, kleda in our language, it is there. So if you are moving about a little bit, now mildly exercising, it will be enhancing the movement or outflow of the uterine contents and will help in easy involution of uterus, reversion to normal.
Okay, that's interesting. So now how about this oiling and binding the abdomen very tightly, which, almost that we cannot breathe in that way. All these caretakers do bind our abdomen.
Yes,
so what is the science behind
it
that?
should not be done in that way. That much tightness, that much loosened is not the thing.
Okay.
It should be adequate for normal respiration. That is the thing. Normal movements, this flexion and in the bed she has to move about. So it should not be restricted. And this oiling is very good. As you know, oiling is circulatory. It has circulatory benefits. Then the skin complexion, skin elasticity, it improves. Collagen production is increased. Then as far as the divarication of rectus sheath, in most of the pregnancies, deliveries, this happens. Diastasis, rectus sheath. Separation is there. A gapping of small centimeters to 25 centimeters may happen. The entire length of rectus may get separated. So in those conditions, it is very beneficial. If you are applying mildly hot oil and bandaging. So if it is regularly done, this can be regained. The tone can be
I think in
regained.
that sense, this is a very good preventive for umbilical hernias also.
Yes, sure.
It's quite common in people who have delivered once or twice.
But the tightness should be as per the everything should be done under strict medical supervision. That is the thing.
And for how long should this be done, ma'am? Like after
This can
delivery?
be done up to 1.5 months. If any complaint exists, then other interventions can be brought into the scene. Because if this diastasis is still existing, we can have local therapies like Shashtigaleba and all. In our hospital, we are doing Shashtigaleba
Okay.
for separation of gapping. It is getting improved.
Okay.
This is red rice. So while this ECP period, the confinement period, when they're doing the administration, they can do the LEPA also, local application. So it's not always just hot water and oils. These powders can also benefit a lot. Right? We already mentioned about the disparities or different traditional approaches to postpartum care. And in a way, it is the spirit of Ayurveda, acknowledging the personalized care and all these things. And at the same time, there is this ambivalence of whether we should standardize these protocols, having a very structured approach to postpartum care. In your opinion, would that benefit the system as a whole or help in some way to kind of establish a proper postpartum care methodology in Ayurveda if we standardize
Yes,
this?
standardization is a must. But it should be according to the scientific references, the textual references. It should take into consideration the Prakriti, Ritu, then the Pradesha, everything. The postnatal care and other therapies varies according to season and other thing, place of living. It is clear in our textbook, Kashiva Samhita elaborates it. So that is the standard. So for common people, we have to communicate. Such things are there. They should be scientifically followed. That communication should be given. So standardization is a must. In our hospital, one workshop was conducted some years back, and we had prepared a protocol.
Oh, Okay. And this comprises all the differences that can happen with the Desha and
Yes,
Kala. And all.
yes, yes. All
And this
should
is
be
something that
considered.
is overlooked by people who are not authoritative or experienced
Yeah,
on this.
they
will
don't
say,
know actually. They think Ayurveda is safe, so it is
they
applicable
just
to
do
all.
it.
All these can be given to everybody.
I have heard people giving this therapy saying that I've been doing the same thing for different people and all this. So the same applies to everybody. It's not the right way to go for it. So we can certainly look for good standardized protocols which accommodates this framework also.
How about the difference in medicines? I'm just curious to know about that. Like we have heard that in Trivandrum side or towards the southern part of Kerala, we have this Pulileham, which is given first. In Malabar side, we use more of kashayas, like Nadi Shodhana Kashaya. And also, how about that, ma'am? Is that dependent on Desha or?
Depends on Desha, ethnicity, and many aspects. As I told about Mahi, such influences are there. Then in Malabar area, I think practice of taking kashaya I have seen, but they are taking kashaya churnas as mukudi. Mukudi, not as solely as kashayas. Mukudi, the kashaya drug is infused in takram. Takra is light, Kashaya is Guru, and while they are taking it with Takra, it is more like Hu. So it is okay, it is good, I think. Then Trivandrum has influence of Tamil Nadu, Pulileha, it has influence. But nowadays we are prescribing Pulileha and all. At the initial stage, if it is okay for her, we will be prescribing. If she can digest Kashaya, then Kashaya. Pradeshika Bhedas are there.
And depending on the patient, surely, I guess.
Ethnicity also is a factor, I think.
So, ma'am, you were saying that you have developed a protocol for the postpartum. So, what would be your advice for young aspiring doctors who have joined us, who are looking forward to start a postpartum clinic and flourish their career? So, what would be your advice for them?
Advice means it is as per the classical textbooks. We should give the postpartum care. The initial days postpartum, you have to give a light diet. Then the medicines are to be easily digestible and assimilable. And after subsequent days, after 3 days, we can have heavy items. Vidarya, Digana, etc. are indicated after 3rd day. Initial stage, Gulodaga is indicated. In the same pattern, we are making or we are designing protocols. First stage, Gulodagam, Panchagola Churnam. That is for Agni as well as the alleviation of pain and to clear the uterine contents. Then subsequently, Kshira Prayoga starts after 3 days. Then more Brahmana after that. Then Mamsaras, everything is coming into the picture. So it is as per, we can make such designs as per the needs of the individual as well as the place of living.
So I believe for the first 3 days or till the uterine contents are fully evacuated
we
the priority is to attain Vata.
The color of Lokya changes. Initial days it is red, then it is brown, then it is pale. So we can observe this, we can examine during the follow-up period of PNC, we are seeing all this. So according to that we can plan and give.
So this could be a better parameter rather than for 3 days we can look for the color of the Lokya and then decide whether we should shift
whether it is okay or not. And the fundal height can be measured. You can assess whether it is coming down. So it is also an assessment criteria.
We had touched upon this topic a bit earlier. Everybody claiming to be knowing about this, so everybody is an expert. And people would come to Ayurveda doctors also with some premeditated knowledge of, should I be doing this or I've been advised to do this and all. So is there a way people who are receiving this care could differentiate or distinguish what is quackery and what is actually...
We have to do.
We have to do. So how can doctors
we have to educate. Continuous education programs should be done and the authorities should also be concerned about it. That means precisely government.
There is a huge barrier of age also, madam. When a younger doctor says, they're like, what do you know? You've not seen enough. It's a common thing that most doctors, I believe, get, the experience factor. So what would be some common messages that doctors can give to the client?
Doctors, they continuously should educate. They go into the society and educate. Community outreach programs. We can prepare pamphlets, then distribute among the people. Then make awareness programs. Then the policies should be made. Health policies should be in that way to prevent quackery.
Yeah, it's actually
This
a
is
great
pure
area.
quackery. This area is full of quackery. Some pharmaceuticals are also giving packages of medicine.
Yeah.
They are liberally giving. How can they give without medical supervision?
That's right.
So how can one take Ghrida in the initial stage of this thing, postnatal period? People are using.
Oh, yes.
Brahmana lekhas they are using.
Right
This
from the start.
can't be done. Proper education is the only way. We can't directly go and tell people don't take, don't take. We have to give the message in
Why? That
in a
why
right
aspect
way.
is not being conveyed.
Coming back to that postnatal practices we have, traditional postnatal, and we discussed this actually, pouring hot water into the tummy, which people cannot
Vedaguli
tolerate. Yeah, Vedaguli. So, you know, and unbearably hot
Yes,
water, I
yes,
would
yes.
say. And especially the young generation, I don't think they are
not feeling
they are, yeah, they don't feel good. So how can we make all this user friendly, and how can we educate people that actually this is needed, but it can be done in a better way? Which
In our unit, in our college Punarnava postnatal care unit is there. We are never you doing this. We are not pouring very hot water. We can modify it. That is what I think,
yes.
Dr.
Yeah, that's a
Anita.
question.
Modification means we can prepare this Snana Udagam, that is the medicated water for bath, with Ushna Dravyas. That is the option.
oh, okay.
Instead of extreme
with
hot,
heating potency.
yes,
Wow.
we can use Vaja. We can use this thing, Piper Laungam leaves.
Leaves.
Such things we can use. Kottam, Kushtam,
Okay.
we can use. So,
nice.
Ushna is there.
The
Why
water needn't be boiling hot.
use lukewarm or one can tolerable amount of heat. That is the right way. We are doing in that way only.
And I have this experience. My wife was given unbearably hot water.
Same here.
She
Same
couldn't-
here.
This is a suffering period for most of the
Exactly.
young girls.
It
They
was
say,
scary, actually.
Scary, postnatal. It should not be there.
This is
Okay.
quite insightful too.
Yes.
Always we can modify. Modifications are there. Such misconceptions can be changed.
In fact, while we were doing a session on the postpartum depression, there was a study that came up saying that the fear of getting the postpartum care itself was a reason for the depression aspect.
Okay.
So probably this Vedaguli was a major culprit bringing in that aspects. So
And no Ushnodagam for head always cool water. Nellika, gooseberry, it is boiled water and cool down and then only pour in on the head.
Okay.
There are indications and contraindications. Vedaguli, it is preceded by Taila Abhyanga. This Taila Abhyanga is not suitable for everybody. I am a person who can't apply Taila on my head.
Okay.
I will get sinusitis and tonsillitis. Such individuals are there. So who is responsible or who will make the jurisdiction in this regard? The doctor can only advise. So these people are liberally giving Taila Abhyanga for head and body. And mother once getting fever, baby will also get fever. Doctor will ask what you are taking, Ayurveda medicines and therapies, then stop. They say.
yeah, and it's common that a lot of people have reactive arthritis and high amounts of
Yes,
acne and all
yes.
this. So they are not accustomed or advised oils. So when Abhyanga is done as part of the postpartum care, naturally inflammation would happen.
Yes,
flare up.
Seasonal variations are there. In rainy season or winter season, we can't apply Chandana Tailam.
Oh,
Yeah,
yes.
cold seasons.
So seasonal variations are also there.
Yeah. So a lot of things are based on the
Cotton
yukti
Juka, we
of
can
the part.
apply. In rainy season, we can apply cotton Jukadi. Other normal season, then in that way.
And this art is lost actually, change our dinacharya according to the seasons.
Yes.
It's a lost art, I believe.
Yes, yes.
We have to bring
Should
it
be
back.
regained.
And this fairly explains what is the role of an Ayurvedic practitioner in postpartum care, actually.
Very true.
Yeah,
Very true.
this is very insightful, I'd say. And just a follow-up question I have to that, ma'am, regarding that oil and, this hot water thing, what we are using. So how about applying hot water to the breast? Because we have generally heard that you should not pour hot water onto your breast since you are feeding.
Yes,
So
yes.
what is the difference in that, or what is your opinion in that?
It is right. Pradesha where excessive heat is contraindicated.
Yeah.
But mild heat application is very good for promotion of lactation.
Huh.
Mild abhyanga with
circulation.
sudation is very nice for
Okay.
initial stages. In initial stages of postpartum, if you are applying anointing and this thing sudation is given, it will help with the promotion of lactation.
Ayurveda advocates a preconceptional preparation process.
Yeah.
And it's not just to have a good postpartum care, to have a healthy progeny and have a healthier recovery postpartum, we need to prepare well in advance. So
Yes.
there is this concept
Yes.
of finding the right time and doing certain procedures well in advance to have a very healthy progeny
Yes.
and to get this procedure. So what are some of those scientific approaches that you follow to facilitate this?
The first thing is the regularity of cycles. Before attainment of pregnancy, the cycles should be regularized. A regular cycle is providing a healthy gamete. In case of a prolonged interval cycle, there are chances of this degradation or aging of gametes. So aging of gametes means premature meiosis and the quality of gametes is faulty. It may lead to abortion. There are chances of getting many diseases to the child also. So it is a very important aspect of science. So we should advise everybody to plan a pregnancy. Then preferably Ayurvedic preconception care is good. Then apart from that, other things, Ayurveda offers preconception care to those having abnormal pregnancies and deliveries or differentially abled children, those with chromosomal errors, then miscarriages, second trimester abortions.
Okay.
Immunological factors. We can give preconception care and for the betterment of the subsequent pregnancy.
So ideally, they should go as a couple when they're planning
Together they should take.
their lifestyle, diet, everything has to be optimized
Yes.
well in advance with the help of an Ayurveda practice.
Yes, BMI should be corrected. Existing diseases should be optimized. These metabolic errors should be corrected. Diabetes, hypertension. If she had a previous history of gestational hypertension, care should be given. More care should be given.
Even that awareness aspect should also come.
yes.
Like people should know that there is this provision in Ayurveda and it has to start much earlier. So once that awareness comes into people, then probably we will.
Ma'am, coming back to the postpartum care, there are a lot of dietary and lifestyle suggestions which Ayurveda suggests. And I think people are not very convinced with all this. Like they generally question, why are you restricting this, why are you restricting that? So what is the scientific rationale behind all these restrictions or guidelines we are providing?
Restriction was there in recent years. It is almost corrected, I think, regarding intake of water. Very less water was given to a postnatal
Exactly,
lady.
yes. Yeah.
It should not be there. Correct intake of water, adequate water intake should be there. As a normal person, she has to take water. People say due to the shunya spaces, the inter and intracellular spaces, they are vacant, so there is chance of water retention. Nothing like that. She can take adequate water, but reduce the salt intake. That is the thing. If we are reducing the salt, limiting the salt, there won't be much water retention. So then about other preparations, medicaments. As medicaments, we are giving this food items or spices. Ulli chora,
Yes.
ulva kanji, all these are dietetics.
Yeah.
And it is transformed as medicine. So ulli chora, it is very beneficial. It has plenty of vitamin B, minerals, antioxidant. It heals wounds. It clears the uterus. So it can be taken. But the thing is that it should not be made anabolic. If you are adding a lot of this thing, ghee. And sweetening, it is having adverse influences. You can give ulli chora, ulva kanji, everything, because in the existing scenario, most of the developed countries, all developed countries and most of the developing countries, there is surplus of food.
That's right.
Food scarcity is very less. In certain areas, there exists food scarcity. So almost all people are well nourished. So metabolic problems are the common thing nowadays. So that much of nourishment they don't need. That is why we have to limit the intake of such anabolic items.
Okay.
So these restrictions are also not like general for everybody.
It depends.
In initial stages of postnatal care, when Kleda is there, then no need to take such items, Ghrida and all. In subsequent days, if she is fit for this, we can give anabolic preparations, then more mamsa, ahara, etc.
In fact, thanks a lot for breaking that myth. Like a lot of Sudigas, we call them, are kind of deprived of essential quantity of water also,
yes.
saying that this is
Yes,
the period
yes.
you should not take. So maybe they might have had this experience of water retention and felt that, okay, it is the intake of water that has to be reduced. But this insight will help more people to understand
And
it.
now it is global warming, it is very perspiration, it is
It's
water
much
loss
higher.
is much, so it has to be replaced.
Even inside an air-conditioned environment, people are sweating. So that is
That should
quite
be
profound,
addressed.
actually. And this brings us to that statistics that we discussed the other day.
Yeah.
We had looked up some numbers and we found that the rates of C-section, Kerala is topping the chart. Like while the national average is around 28, we are 40% incidence, the C-sections, which is especially in private hospitals and even in government sector, it's somewhere around 35. Brazil is the largest, I believe, 55% of the
Percentage
deliveries
is
are
there.
C-section. So how can we, is there any way in which we could reverse these numbers, enable more normal deliveries? Is there a possibility for that? Or
If people are demanding C-section,
Oh.
no way.
So you're saying that
Many people are demanding C-section. One of my patients was undergoing a treatment for fertility problems. She told, ma'am, whether I am getting conceived, I will never go for a normal delivery. She was undergoing the hectic schedule for preconception, or we were trying. No positive responses were there, but still she is saying, I am not willing for a normal delivery. So one factor is that. Then elective cesarean sections, I don't know whether they are under strict, I don't know whether I can say indications based or
we can look for
demand
things that
based.
enhance normal delivery, the
Yes,
chances.
that we can improve. The preconceptional care, the BMI maintenance, correction of metabolic problems, then diabetes brought into the normal level. We can also intervene with our therapists. We can give, if she is in a pre-diabetic or diabetic state, we can intervene.
Okay.
Then other masanumasiga garbhini parijavya is there. We can give kshira kashayas or other medicaments as per the need of the month or week. That way we have normal plans are there, so that we can give. Then right before the expected date of delivery, we can go for our therapist, Panchakarma. This, we can give Anuvasana. In Pujapura, we were liberally doing that time. This thing, Yoni Piju, Snehavasti. We can do Abhyanga, Snana. All these are
So you practically
conducive for
found
normal
that,
delivery.
these things are increasing the chances of a normal delivery.
Yeah.
So
If the
just
patient
If
is
the
willing.
patient is willing.
Yeah, that's a good.
But why would a lot of people opt C-section? Like I'm asking for the
That may be
common
due to
person.
the fear, the enormous degree of exaggerated thing. Then about the Rupa and all cosmetic aspects, it is there. The widening of introitus may be a factor. It is never reverting to the normal state. Vagina is not
Correct.
completely reverting. But with the proper postnatal care, to an extent it is possible. So these may be the reasons. Strict indications will be there. Then some are
And we also saw
demanding.
that, more the C-section, the lesser the chance of the immunity factors building up in the baby and all.
Yes.
So that's also very profound.
Yes. I think we should also discuss about the pregnancy care, which is very well explained in Ayurveda, which people are least exploring, I would say. So, what are your thoughts on that, and how will a pregnancy care routine positively impact, the
Outcome.
delivery and outcomes?
Pregnancy care that I have already mentioned, this from the initial stage, apart from supplements, we can give the drugs which are congenial for that time. For first trimester or the initial stages of pregnancy, just go for garbhastabana. That is for stabilizing
Stabilization of the
garbha.
fetus.
We can give garbhastabana gana. Kshira Kashayas and all. Bhalasarpi is very important drug in this aspect. If she is eligible for this thing, for intake of Sarpi. Then mid-trimester, the problems are usually water retention, then hypertensive disorders related problems. In that angle, we can give the specific drugs mentioned for that time. Specific drug means lot of drugs are there. Gokshudak, Shirakashaya is there. Nitiktiga is there. So such medicaments we can, combinations also we can give. Then just before labor, then Sugaprasava Grida is there. We can give.
Yeah.
Then this therapy is also advisable. Then general advices on diet, what all things she can take. This prevention of constipation is an important element. There is chance of hemorrhoids in pregnancy, so it should be prevented. Such kinds of food items we have to advise what all things she can take, and those which are contraindicated. Advices can be given.
You brought up fellow surface. I just remembered a incident which makes this conversation very relevant. Because earlier, long back in Kerala, when marriages were fixed, both the bride and the groom would be given fellow surface for one mandalaka, that is 41 days. So this is during the engagement, and by the time their marriage time is ready, they are all not only just looking plump, and the fertility chances, the healthy process, all these things are also facilitated.
Cannot be liberally given. If it is fit, they are fit.
And probably at that time, the Sandarpana problem was not there. People were not already overnourished.
Nowadays, Sandarpanodhavyadhis are there. So that is why we have to.
So it's better not to follow the same principles again. I have a connected question to that. I've heard a lot of people wondering if we are doing the step-by-step Ayurvedic pregnancy care, there is a very high chance that the baby would also be overgrown or overweight.
Chances are there. If Kshira is not good for her, we can give as Kashaya only. Kind of modifications should be put forth.
So it's personalized.
Yes. If Balasarpis or Sarpis are not good, we can substitute with Churnas or something with similar properties.
Right. And also a supplementary question to, in your forte, that we mentioned about the lifestyle disorders, like you can see in a majority of gynecological problems that Ayurveda receives currently, the presence of lifestyle is very profound, like be it endometriosis, PCOS, the number one, PID, we just mentioned, infertility is also a major aspect. So are there any specific ways in which Ayurveda can address this lifestyle aspect of gynecological disorders? You can state it as some examples from your practice itself, some areas that you're focusing, which needn't be the core area of our topic today, but would be worthwhile to listen to.
Okay. As soon as a girl is getting a menarche, from that time onwards, proper care should be started. A shift from the food pattern of childhood to the adolescent food is the main thing. In the childhood days, you are giving kshira, ghrida, everything, sweet items, everything. When she is getting shifted to the reproductive age, that is the puberty or menarche, the dosha constitution vary. It has become pitta predominant. It should be like that. That is conducive for normal menstrual cycle and fertility. So such fertility boosting food should be provided to the girl. So not getting completely detached from those given, we can add some other foodstuffs. For example, tila, masha, kulatha, vrindaga, malsya, takra, everything, amla bhalas, all this can be given, added to the diet. This is the first aspect. Then regarding menstrual hygiene, it is very important. What is menstrual hygiene? What are things she has to observe? There are frequent attacks of soreness, rashes, etc., napkin allergies, then menstrual cleanliness, chances of infection. So she should be well educated. If she is getting a lower genital tract infection, subsequently there are chances of getting into the upper genital tract and getting a PID. So regarding all this, then sexual hygiene is also important. It should also be well educated. Sexual cleanliness, when they can do sex, then during menstruation, sex is not good. But the alkalinity is there during periods. So if they are indulging in coitus, there is a chance of getting infections. All these should be well educated. Then regarding the body constitution, then maintenance of BMI, this exercising, normal exercise, it will be preventive to great extent in PCOS. If she has a family history of some illnesses pertaining to the reproductive system, additional care should be given. If her mom has conceived her after a long years of married life, then there is a chance of lowered fertility in the family. She's a single kid to her parents. There are chances this can be inquired. So such factors, in case of such factors, additional care can be imparted to the girl. Then once if she is diagnosed as a PCO, then effective management is there. We can, according to the body constitution, you can give. Lean PCOD is there, moderately built is there, obese. The protocol varies. And effective protocols can be implemented and her cycles can be regularized and her weight can be normalized. All this should be done. Likewise, other diseases also. This fibroid, we don't know the cause of the disease, but it is estrogenic. Fibroid, adenomyosis, endometriosis, everything is estrogenic. So, such kind of food, those food items that are having profound influence on estrogen stimulations can be avoided. That is this anabolic food, more meat items. She can follow safe non-vegetarian food. Fish is the ideal thing. And not fried. Fish curry, Kodambuli fish curry, ideal.
Best.
That's actually
thing.
one of the problem.
Wow.
When we say we can give fish,
They
we go for the
fry.
worst version of fish.
Yes.
Then fast food, junk food items to the minimum. Once in a while they can have. If in a young age or an adolescent girl we are telling don't take, that will not be good. So you can take once in a while, you can have.
And ma'am, what about the postpartum diseases that usually occur? And how would we advise our patients to prevent it or manage it? So what are the common conditions that you see in your practice?
First of all, pain. Painful lower abdominal pain, perineal pain. If the episiotomy suture is there, that area aches. Then backache. Backache from cervix to coccyx, anywhere.
Very common.
Epidural
Yes.
analgesia,
Yes.
that side. Fine epidural hematomas may be there. Then related to discharges, lochia, extended lochia rubra, that is reddish discharge getting extended. Then lactation problems, decline in lactation, soreness around nipples, cracked nipples.
Yes.
All these are issues faced by ladies. So preventive aspect is very important. The proper care provided during the antenatal period, then the restriction of certain unwholesome dietetics, all this prevent this hemorrhoids. Hemorrhoids is another thing. If she has a hemorrhoid in the antenatal period, better it should be corrected in that period itself. Because if she is having constipation, it should be corrected, because living with the constipation in the postnatal period is very troublesome. With stitches and all, she can't evacuate the bowel properly. It is very difficult and the stitches may give way. So it should be thoroughly cleared before the delivery. So regarding the perineal pain and all, light exercises can be advised. Immediate postnatal period itself, after 1-2 days, we can advise gentle postnatal, the Kegel's exercise in that pattern. Hold, then relax, hold, relax, that pattern. It will improve the venous and lymphatic drainage and it will reduce the inflammation. Then local applications are possible. In pubic symphysis area, there is chances of pain. There is separation during the delivery. So in that area, we can give local applications, marmavatta or kartavatta. Such measures are there. Even in analgesic, this anesthesia pain, lumbar anesthetic area pain, we can apply marmavatta. It will be getting considerable local applications. Many such medicaments and therapies are there in all these areas. Constipation relievers, better don't give laxatives or purgatives because it will affect the baby through breast milk. So better corrected through fiber-rich food, adequate water intake and all. Then if it is not getting corrected, then only give some medicines. It is important in pregnancy also.
Important, yes.
In early months of pregnancy, don't give purgatives. Advanced days we can have.
This is actually very important.
Very important,
point
yes,
because,
yes.
What the mother takes,
Yes.
Affects
baby
the
takes
baby
too.
It is-
also.
If mother is taking this enormous fatty food, the milk will be heavy. Kabha dushta stanya. We can do stanya varishansi,
Yes,
sinking
yes.
into the bottom, and the baby will be feverish and.
And one more follow-up question to that, ma'am. As you mentioned, cracked nipples. I think many mothers are currently struggling with this problem. So, what are the preventive strategies we can adopt?
Abhyanga before labor, before delivery. 8th, 9th month onwards, see, they can do Abhyanga and Ushnodaka Snana they can have. Abhyanga, liberally apply the area with Taila. Then if there is retracted nipple, it can be averted and this can be done. The preparation for lactation should begin before delivery, because in the 9th month of pregnancy, the Palkashaya which is indicated or Shiragashaya which is indicated is Shadavati. Shadavati has a role
yes.
for
Lactating.
preparation for lactation. It is a uterine tonic. It will prepare the uterus for labor as well as Stanya Janaka.
That's interesting.
Interesting, actually.
We only concentrate on this postpartum after deliveries, but this is a
Before
very
we should-
valid point. Yeah.
We wait for problems to come and then
Then
look for
address.
management.
Yeah. Shamala madam, those days in pregnant ladies I have seen applying this Durvadikera in hemorrhoids. Highly inflamed this hemorrhoids. But sudden shrinking I have seen.
Oh, okay.
Durvad. Local application, many ointments are there nowadays.
I believe a lot of Ayurveda doctors and aspirants are also listening to us. So we've also mentioned about Ayurveda clinics, and there would be a lot of people who are not doing it in the authentic way. So how do you envision your Ayurveda center, like focusing on gynecological and postpartum care? How should be a doctor's clinic? How they should be equipped? And what should be the ideal positioning of somebody who is going to focus on postpartum care? It can be your vision. It means like
My opinion that anyways, if it is possible, it should be done under a specialist. That is my opinion. One who is specialized in Prasudandra
Yes.
Sriroga should be in charge of that institution.
at least as a
That is the
consultant.
fair thing. As a consultant or advisor, so that she can monitor everything. That is the right way.
Right. Understood. So we are having a Prasuti doctor. We are setting up a clinic. How should it be?
Then a protocol should be designed, designed according to the desha, each deha, prakriti and all, seasonal variations that should be put forth.
Okay.
Such designs should be there.
All right. So,
Then revision should be done as per the needs of the. If we are administering something, a drug, if it is not good for her, we can substitute it. Substitutions also should be there. A therapy, if she is not fit for it, then it can be changed.
Okay.
And the others should be well trained.
Trained.
Other faculties should be well trained in this regard.
Correct.
And we need a therapist who are well trained.
On this
Educated also. Educated, well trained. Ayas should be there who are dedicated,
Correct.
skillful. Everything should be there. Then only set a hospital.
All the qualities of Parichara.
Yes, everything should be
Because
there.
compassion is very much relevant.
Very much relevant.
And ma'am, coming back to the traditional practices we have, there are a lot of lehas which are generally prescribed in postpartum care.
yes.
There is Sengam Pukaladi, there is Ajashwagandhadi, all these things, Pushmanda.
many lehas are there.
What is the selection criteria behind all this? Or
I
how should we
I
prescribe?
usually select those having digestive action. I choose first. Those which are Garbhashya Shodhaka, that are also selected first. For example, I first give Vilwadileha for 2-3 days for improving digestion.
Okay.
Next, Pulingurumba.
Okay.
Go for Pulingurumba. Then, if there is pain or muscle stiffness like that, you can opt Kurinyikurumba. In that way it goes. Then at the stage of Brahmana, if she is fit, we can give Ajashwagandhadi or Vidaryadi, such combinations. It is just according to that individual only I give. In many cases, I limit up to Pulilehya or Urnilehya. In individuals who are professionals or students like that, I prefer this thing, Chanabrasha, those having Medhya properties. This is the selection I
So does
usually
that also
follow.
act in postpartum depression? Just curious to know.
Yeah, maybe.
They're both connected, right? So, like managing this would also manage this.
Correct.
This is the usual way I select. Then in Bukuladi also, in case of this joint problems, back pain, etc., I select.
And what about postpartum obesity? Like a common problem that we see nowadays.
This is the consequence of that thing.
The
Liberal administration of anabolics properties.
understood.
That should be limited. That is the thing. And early ambulation should be promoted. Complete sedentary is not good.
By early ambulation, you mean
Just move about, sit and feed, sit in a comfortable chair, then with cushion support, with back support, with footstool, then pillow raised.
Okay,
Everything should be the posture should be
ergonomics aspects. Okay.
It should be maintained. Then go to the toilet, then walk a little while. This can be done.
Right, understood.
After Abhyanga and all, she can walk in her room. This all promotes circulation and her toning up of muscles. Everything happen.
They should not be taken care like dolls.
No need. No need.
Actually, sometimes they are taken care like that. They are
They
advised
have
not
to. They have to involve to their normal activities some days after. So, what is the need of doing complete restriction? It's not needed.
So I have this question, which I think most of the laymen may be having in mind. In case if we have an early second pregnancy after the first child, should we stop breastfeeding the first child, or how is it actually?
It depends. It depends. If the lady is having some complications, she has a chance of abortion. Previous history of abortion, better stop, because this thing is stimulating oxytocin. Oxytocin is conducive for uterine contraction. So if it evoke a uterine contraction, there may be pregnancy loss. So immediately after the diagnosis of pregnancy, no need to stop, just wait and see. For a while she can give, but during advanced month of pregnancy, the nature of breast milk changes. It becomes more salty, I think. The taste is different, the thickness varies. So that is not that good.
Okay.
So she can feed for a while, then see her condition, then only stop. If any bad history is there, stop. If her uterus is that much sensitive, she has to stop. That is it. That this after pain is also coming while sucking. During breastfeeding, sucking create the rush of oxytocin. That is why the pain is there. After pains are there. So there is relation.
C-section, like we already saw that the incidence is much high. So if somebody who has undergone C-section comes for postpartum care, what is the ideal time to start this? Like I know it won't be the same for both.
Difference is there.
So how can we differentiate?
Differentiation is one thing regarding internal medication. We can start internal medication after stopping the hospital medication. Analgesics, antibiotics will be there.
So that's not to go.
Go together.
Okay.
May not go together. System will be getting irritated if you are administering some arishtas, churnas, etc. Better we can start. Kashaya tablets we can have. Then regarding the snana and all, third or fourth day we can have, but cover the area. The incision area of incision should be well covered, and then snana can be done.
Understood.
Then rest of the treatment we can do after. Then kiri or abhyanga or anything, avagaho, anything. We can wait for the healing of wound. Then only. Then continue the postnatal care a little more. That is good because it is operative. Some traumatic can imply. So you can extend the postnatal care. Then this binding etc. should be thoroughly done. Avoid till the complete healing, or it is loosened and apply. Afterwards, it should be thoroughly done.
Okay. So to summarize, I think if the patient has gone through a C-section, then wait for that healing of the scar and also the medication to wean off, and then do these procedures, and you're not losing anything.
Yes, potent medication should not be given. That much tikshna should not be given.
Understood.
Okay, ma'am. And ma'am, we have already discussed about the Suluvat Kani, all
yes,
these,
Uli
anabolic kind of preparations. And I guess there are some set protocols that are followed in current days, like by some practitioners. Give Arishta for 14 days or give Kashaya for 14 days. Next 14 days is the Smoola Jeeraga Arishta. Then it's Leha or all these preparations. So how can we define a protocol? I know it's difficult to say, but for an ideal patient.
In an ideal patient, we can give for first 3-4 days, or it can be extended up to 7 days. Dhanudara Arishta, Jeeraga Arishta. Dhanudara Arishta is more good in C-section patients. Dhanudara Arishta, Jeeraga Arishta, or Dashamula Arishta we can give with tablets. Dhanudara Gulika, Hingu Ajadi Gulika we can give. Then switch on to mildly anabolic, that is Ashwagandha Arishta, Draksha Arishta, Jeevaniya tablet, or Jeevaniya Ganapal Kashaya. Okay. Then to more, if needed, we can switch on to Lehas. Ghrida if needed. If she's fit for Ghrida, we can give.
Okay.
Then regarding the Abhyanga, also we can have a protocol. First start with cotton Jukadi Taila, then move on to Dhanudara Taila, then Dhanudara Kuramba. That way, Balashugandhadi Shashtiga. That way, mildly Brahmana, then to
gradual transition.
Okay. That is the thing I am following.
We touched upon arishtams and legumes, which is kind of has become a taboo for many. We, so much so that people abhor taking arishtams and legumes. So, how relevant are they? Would they interfere with the postpartum line, or is it just a fear, or is there reasons for people to fear arishtams and legumes?
No need to fear arishtam. We can have it for a short period of time. For uterine clearance and all the pain alleviation, it is good. It is ideal, and quick action is there. So it can be taken, but after food only. The strict precautions should be taken.
The dosage type.
Yes, dosage should be fixed. Can have a lesser dosage, not to 30 or 25, can 20 or 15. In the initial days. Then system is getting okay, then she can have. Then suspend the intake of arishtam after some 12 to 15 days.
This is very important actually, ma'am.
Continuous administration of arishta is not needed. The purpose is these two: alleviation of pain, clearance of uterine contents.
A lot of observations are coming up these days, because of the administration of Ayurvedic medicines like lehas, bottled kashayas and everything. The newborn babies are getting a lot of gastric discomfort. So what is the exact rationale? Is it happening because of our bottled kashayas? Should we switch to some other form of medicines? Or what is your observation?
Bottled kashayas not a problem because the safety is already considered. FDA or certified things they are using sodium benzoate. It is very safe. We can substitute. Tablets are there. If they are not, if they feel they are not user friendly, can substitute with tablets. Regularly we are inquiring our patients whether you need kashaya or tablet. Then they can have coarse powder and prepare kashayas if their palatability is okay. Kashaya is not at all a problem. It is not creating. From my experience, it is not there. Kashaya or mukudi, giving for the prescribed time format, restricting the prescribed time format and give. No problem.
How about lehas, ma'am? Does this cause,
lehas may cause problems. That is the same thing I told earlier. Due to the Brahmana property, it may create, the quality of breast milk may vary. So it will create problems to the child. If that leha is not good for that lady, if she's not fit, that is the thing.
That again explains the need of expertise and in the field, right? Yeah.
Postnatal care should be done under strict supervision of gynecologist.
I believe we have to wind up. I know the questions are pouring.
Endless.
There are more coming in, but there is this paucity of time. So, ma'am, before we conclude, I would like to know, you are in this area where you're very closely connected with women and children, and this must have certainly molded who you are today. Because for the knowledge of the audience, Dr. Anita is also a very accomplished poet. So, in totality, how did this department, this area that you're expertise on, molded you as an individual?
I was comfortable working with women, that is one thing. And they are facing a lot of problems. in many areas there are problems. Health oriented issues are there, personal issues are there, psychological issues, then psychologically attributable menstrual problems are there, premenstrual tension, perimenopausal problems are there. These should be properly addressed. That is what I think. So what I can do to that extent, let me take part. That was the mission. Our project Anandara is on perimenopausal care. Anandara, we have launched a project in our institution that is addressing the perimenopausal problems of women. It is a multidisciplinary project. So it is going on. It is in the track now.
Looking forward to see the progress, ma'am.
Yeah.
So I wish to take part in such activities.
Certainly. What would you like to tell our audience,
Regarding
what you've
yes.
learned so far? It could be anything.
As doctors, while managing the problems of women, the first and foremost thing to be is a good listener. They actually demand a listener, a patient listener. It is very important. After that, then address her issues, then educate them as far as possible. Be empathetic. A bit sensitive is good. Being a bit I feel so. Being a bit sensitive is good in this profession. So the social issues, what is justice? What are the financial possibilities? There are many chances. We have to educate the woman regarding self-sufficiency. It is very important. If they are not getting chances of higher education, they are suffering a lot. Without employment, they are suffering in the household. We are seeing many women. So compassionate or being a listener, we can contribute a little. Then addressing their health issues, they will be getting satisfied. They know the safety and efficacy of Ayurveda. As far as possible, we have to propagate it more. The possibilities of this postnatal care, what is safe to them, what is unsafe, the quackers, everything we have to address.
Yes.
So the policies, authorities, the health policies should be modified. These are the...
Beautifully said, actually.
Yes.
So, the appreciation of whatever we said, that compassion element is there. So, certainly, there are a lot of questions that has also popped up.
Okay.
So, Dr. Dev would summarize the questions for you, and you can select the most relevant ones and answer a few.
Okay.
So we have two questions. How to manage episiotomy stitch healing while postpartum care, as well as how to handle postpartum care after cesarean deliveries.
Episiotomy stitch we can manage with our medicaments also. For enhancing the healing process, we can have internal medications. Then the medications in which we have already mentioned, methi and this thing, onion. These are helping in antioxidants. They help in wound healing. Dermatologically, very important. This onion is in our system, in allopathy and in homeopathy. Onion is a main ingredient of dermatologic range of products. So it is very important. Then Jatyadikridam we can apply for healing, wound healing. It hastens the wound healing process. Then the other question, cesarean section, we have explained, I think.
Yeah.
So we have Dr. Anil with us, Anil Kumar. He is the Executive Director of Kerala Ayurveda Limited. He was present throughout, so he would like to acknowledge you.
Yeah, thank you, Nimi. Thank you, Dr. Anita Kishan, for joining us for this talk. It was very interesting. I joined only halfway through, but the discussion was very fruitful. And your deliberation on the postpartum care is very interesting, because nowadays if we see that most of the 5-star hospitals are having postpartum care with Ayurveda. Especially many places I have seen. My brother-in-law is also having an allopathic hospital, Edapal Hospital, and in Cochin they also have started. So in this context now, I would like to ask you one point that what would be the message to the new generation women who is pregnant because they are all stressed with their daily routine and they may not have time to take these treatments for 30 days or 50 days or 60 days. So what should be the shorter period packages which will help them to regain their health, come back with the the physical and mental energy. So, and what should be the uniqueness of Ayurveda postpartum care? Because allopathy, I know that there is no postpartum care. Even they just leave it. They only make the patients or the mothers, make them afraid that prenatal care they have to be very careful, and you should not take any medicine. But nowadays, after delivery, they are advising, okay, you can go for some Ayurvedic treatment, but it should be care. And they are also started by themselves, so that the propagation of Ayurveda is on postnatal care will again come from allopathy segment. That's the funny part. Anyway, I would like to know what is your suggestions for the new generation, what message we should give to them to attract them to this postnatal care and for the child care.
Regarding new generation, they believe there is something damaging for them. That is the hot water application, the pouring of water that we have discussed earlier. So such things should be corrected and correct messages should be given. This is not something alarming. It is very safe and good for their future health. So their physical and mental well-being. Such education should be done. Then in government sector, the maternity leave is extended, so they can have. But I don't know what is the thing with private sector.
We can ask her.
They have to cut short the number of days and the therapies altogether we can't do. We have to prepare a protocol for them also. In the immediate future, I hope we have to deal with this also. Then about allopathy hospitals, if they are doing this with the correct with the help of or the in accordance with Ayurvedic parameters, Ayurvedic postnatal care programs, as in the scientific segments, it is good. Otherwise, it is like cracker ring only.
Just like you said, there has to be an expert.
There should be an expertise there. If it is like that, then it is okay. That is my opinion, doctor.
And how about fast tracking this?
Fast tracking, we have to plan. We have to plan. I think 1 month is essential, doctor. I think so.
Sure. And I think one area which we lack or what is need of the hour is like we should have some books small write-ups or books coming out from people like doctors like you.
Yes.
And
Sure, sir.
you can also coordinate because what is the awareness we have to generate among public, especially these ladies, working class as well as the new generation women. What are the messages we should give? And because wellness is the what is gaining among the younger generation, they have looked for wellness. So how can they regain the wellness after delivery? And so I think a more scientific interpretation or knowledge sharing with Ayurvedic background should be there, with some books, small literature, or even. So that kind of, I think, work we should take up along with the support of Dr. Anita.
Yes, sir.
So
Yes, sir. We have already discussed it here. Preparing pamphlets and issuing among the public, educate the public regarding this, the importance, the need and significance. Let us try together, sir.
Yes.
Okay, that's all from my side. Thank you for joining.
Thank you, sir.
Thanks a lot, Anil,
Thank you, sir.
Thanks a lot.
The association with you. Right?
Yes. So
Thank you, sir.
I believe it's time for us to wind
Yeah,
up. But,
it was quite interesting.
Quite interesting. We had
Very
a lot of
insightful.
challenges because while we were coming, like we said, this is quite experimental. So she was asking, am I the guinea pig here? In fact, you were. So we were doing a Zoom in parallel to a professional shoot. So there were a lot of uncertainties. There were things beyond our control. A lot of things got interrupted and delayed. But despite all that, your presence, your expertise, and your contribution was so enriching and so engaging.
Thank you.
We lost the track of time.
Correct.
And I believe this has brought in a lot of valuable information and insights, not just to the doctors. One of our key intent was to, make doctors, enable them to converse with their clients better, from your experience and expertise, transcend that information. So I believe despite all that glitches, we were able to extract a lot of information from you. We will keep doing that, especially with the publication and all things coming up. So we all, so let me, not just in my personal regard, on behalf of Dr. Neetu, my team members, Dev, Mahesh, Amrita, Maya, they're all here. On behalf of Kerala Ayurveda Limited, I deeply, from the bottom of my heart, say
Thank you.
to you.
Thank you very
Thank you,
much.
ma'am.
Thank you.